Jim, this UK approval and the hopes that the FDA is just about a week behind.
Look, we have to think about the number, the amount of vaccines out there. We're talking about 40 million. I mean, people are worried about 40 million in the United States. Now, of course, this is only 20 million people, but only 20 million people would take care of all the first responders and would take care of the people in long-term care in our country. I don't think they're taking our vaccines. We're going to have enough, but this is monumental, and it's going to put incredible pressure on our own regulators to get this so we'll have this within the next 10 days. And David knows that I am bullish on this. I was not even as bullish. No, I was not bullish enough, David, because the UK, which has a very serious group of medical people, is saying, let's get it done. I mean, the UK is not some third world country.
No.
I mean, I'm lesser developed, sorry.
No, it's not. No, it's not. And we're waiting. And we're obviously focused on this and the distribution. We heard from the CDC yesterday. As expected, of course, as you would hope, healthcare workers will be the first to get vaccinated. And they certainly need to be, given everything they've gone through. And by the way, they are overtaxed right now to the point that they haven't been throughout the pandemic in many parts of the country, Jim. I know it's something we don't talk perhaps enough about, the sacrifices that they have made. But they will be first, then people in nursing homes, and then on from there. And you heard Dr. Fauci yesterday, or we had sound from him yesterday, saying perhaps April and May, healthy-bodied 20- and 30-year-olds will be able to get the vaccine.
I think that he's, look, Dr. Fauci, to disagree with him at this point seems a little, it's a puerile. I will say this, though. I do think that there's, we haven't heard from J&J. They've been mum. I do know that Emergent Bio is talking about maybe more than 1 billion vials. So I don't think the issue is going to be the quantity. There was a main government servant on Brian Sullivan's this morning, who was talking about all the state bottlenecks. Look, there's not going to be a bottleneck unless there's no CVS, no Walgreens, no supermarket, no Walmart, because those are the ones that are ready. Remember, it's Operation Warp Speed, which Pfizer's not a part of, but the other guys are a part of, which then goes to McKesson, which is very good, knows how to handle wholesale. And then right to CVS, right to Walgreens. You'll go to the CVS website, you'll get an appointment, and you'll get this. And I don't understand why people think this is going to be so hard. Yes, there are states that are worried about people not being able to get it, but the long-term care, I mean, you talk to someone like Deborah Cafaro, who runs Ventas, which is the biggest long-term care, they'll have it by Christmas. I think this is amazing. Carl, I think that no one was expecting this to be this good.
Yeah, I mean, you're not suggesting that supply is not going to be an issue.
Not an issue.
Scott Gottlieb talking with Andrew earlier this morning about whether airlines, for example, should start demanding that you show proof of vaccination. And Gottlieb's point is we're not going to have enough to make it a requirement to engage in commercial activity in this country. No, I mean, look, I think that I'm saying we're enough for the people who are at risk. The people who aren't at risk, I think that could be. A lot of those people, by the way, are asymptomatic, for heaven's sake. I mean, it seems like the NFL is largely asymptomatic, except for the Baltimore Ravens. I do think that we're the healthiest people will be able to wait. I think that otherwise, you're talking about 30%. We went over this yesterday, possible 30%. These are Dr. Gottlieb's numbers for some states. Some states are so out of control that I don't think we have any idea, David, what it really must be like to live in the Dakotas.
Yeah, no, I think there are, we bring on the hospital administrators, sometimes they're doctors, sometimes not, who run these hospital systems in various states. And I can't say that any of them have had anything to say other than it's a bad situation or a dire situation.
Right.
And that they are not expecting these weeks ahead. And we've said it so many times. We can certainly now see on the other side of this, you're pointing out, I mean, it could be as soon as Christmas that people in nursing homes and those kinds of facilities can have the vaccine available. But it is going to be a rough few weeks, if not potentially months ahead in terms of new cases, in terms of hospitalizations. And unfortunately, even with the death rate being a lot less than it was in the spring in terms of deaths.
Shepard Smith here. Thanks for watching CNBC on YouTube.